Well, President Joe Biden has made it clear he wants 70% of our nation's population vaccinated by the 4th of July. Infectious disease experts say that is the only way to ensure we reach so-called herd immunity. When I spoke to a Mayo Clinic ICU nurse this week, she didn't speak about herd immunity when making the case for vaccination. She talked about what it was like to watch a beloved patient ravaged by the disease give up and die. The moment she had the opportunity to be vaccinated, Mayo Clinic ICU nurse Katie Kulhanek did it. The move was consistent with her legacy as a caregiver.
It feels like a privilege to me. We talk about it a lot in nursing, this idea of it's a privilege to care for patients. I consider getting the vaccine a privilege to keep myself safe, and it's a privilege to keep other people in the world safe.
Spending the past year immersed in the messy and painful process of caring for people as they die has made Kulhanek and her fellow frontline medical professionals advocates for vaccination. Although dying is a part of life, of matter, of souls, watching it happen again and again over the course of a year is heart-wrenching.
Is there a day in over the last year that you could describe as having been your toughest day in the ICU?
Yes. One day in particular that stands out for me is we have taken on ECMO patients on our floor, which is essentially we remove the blood from their body, we oxygenate it, we do the work of their lungs, and we put it back into their body. So these are very critical patients. However, the machine itself is so amazing that it can really mask a lot of these people's symptoms. So they're awake, they're talking, they seem healthy if you don't really understand what's going on. And we had one patient in particular who I got very close with, and Spanish speaking only. And this patient decided that enough was enough. They were tired. They didn't want to do this anymore, which is obviously within their right. So I spent the day reading the Bible to them in Spanish, and then we got them to the chapel, and the next day we turned off ECMO and let them pass.
Doing that interview by way of Zoom and Katie wearing her mask may have made it difficult for you to fully feel her emotion. Let me tell you, Katie's emotion was both palpable and convincing.